Hi, and welcome to Virginia Urology Preparation for Radical Prostatectomy. This class is going to provide you information in regards to your surgery that's coming up and the recovery process, what to look for and when to call for assistance or for any information you need from your doctor. You can call at any time at 330-9105. You can text if you have questions, and one of the best ways to communicate is through your portal. So if we go through the class and you have any questions, or you go home and you're in recovery and anything should come up that you have questions about, please reach out to Virginia Urology and we'll be glad to get back to you. What is a prostatectomy? The prostate's the male reproductive gland, donut-shaped organ, about the size of a walnut. It's located just below the bladder. This is your bladder right here, and it surrounds the urethra. The urethra is the tube that carries the urine from your bladder to the outside of your body. A radical prostatectomy is a surgical removal of the prostate gland and any other surrounding tissue that the doctor finds necessary. The usual length of stay in the hospital is 1 night for a laparoscopic procedure and 2 nights for the open. This class is going to provide you information on things not to do after surgery. The goal of this class is to help you protect your internal suture line. It's at the bladder neck. You're not going to be able to see it, but it's your ultimate goal after surgery is protecting that suture line. There are 2 types of approaches with this procedure. Laparoscopic robotic assisted is one procedure. Typically, there's a 1-night stay in the hospital with this procedure. Your open procedure is typically longer than 1-night stay in the hospital. The follow-up instructions that we're going to provide you and the take-home information is the same regardless of the procedure that you have. Displayed on the screen in front of you on your left is the incision line for the open procedure. On your far right are the incisions for the laparoscopic procedure. Protecting that internal suture line at the bladder neck is the ultimate goal after surgery. Regardless of which procedure you have, the instructions that are provided within this class help you to protect this and to get you to a healing process. Kegel exercises. The exercises used to strengthen the pelvic floor muscles that support your bladder. The purpose of these is to gain control over the urine loss that will occur after your surgery. The exercise consists of you squeezing the muscle for 3 seconds, then relaxing it for 3 seconds. You're to do this a minimum of 3 sets of 15 Kegels each day. A good reminder is breakfast, lunch, and dinner. To gain the most benefit, start exercises prior to your surgery. Once the catheter is in place, you are to stop your Kegel exercises until your follow-up appointment. So during your recovery at home those first few days, until that catheter comes out, you don't do Kegel exercises. Kegels must be stopped the day of surgery. A good way to let you know that you're engaging this muscle is if you can start and stop your urine stream, then you have engaged the muscle and you have successfully done a Kegel exercise. Pre-admission testing consists of several tests. They may include all or some of the following: urine and blood samples, chest x-ray, EKG. When you come, please provide a list of your current medications prescribed over the counter. Note that it's very helpful to bring all of your medications. Bring copies of recent tests, procedures if you have them. Bring the names and numbers of all your physicians who participate in your care. At At pre-admission testing, you want to disclose all of your allergies and or anything you've forgotten to tell your physician. This is the point where you want to talk about anything that's ever given you a reaction. Disclose and describe any adverse reactions to the medications, the prescription, or over the counter. You also will be given pre-op instructions as directed by your physician to follow. What to bring to the hospital? Remember to pack light. Your person that's with you will have to carry your bag until you get to your room. Robe and slip-on shoes, ideally with the rubber-soled bottoms. For safety reasons, we want to make sure that the bottoms have the rubber sole on them. You want to wear loose-fitting pants, such as cotton shorts or sweatpants. You can bring toiletry items or your toiletry kit with you. List of your current medications, even if you've already given it to us previously. Wear your glasses and dentures, but be prepared to have them removed in the pre-op area. Bring your CPAP mask if you have sleep apnea. That will be labeled and used for use later. Try to leave all jewelry and valuables at home. What to expect the day of your surgery. In the pre-op area, you will meet your anesthesiologist to review the medication, allergies, and to assess your airway and your teeth. The nurse anesthetist and the operating room nurse will also greet you. Please discuss any changes in your allergies, any changes in your medications, or your health since your pre-op testing. If you were seen for a splinter or anything, put on an antibiotic, or had a cough or cold, these are the people that you want to tell. Your IV will be started in the pre-op area by the nurses. Compression stockings will be placed on your legs to help prevent blood clots. The pre-op medications will also be given in this area. At this point in time, you may have one visitor with you in this area. For surgery, you're then brought to the OR. Anesthesia will give you the anesthesia medications that will keep you asleep during surgery. Good news, guys, the catheter goes in after you're asleep. So the insertion of the Foley catheter will take place after you're asleep for the surgery. Once you're in post-op or PACU, which is also the recovery room, they will be monitoring you closely by the PACU nurses and the anesthesiologist. You're going to wake up, but you'll be drowsy upon arrival to the recovery room. Some of you might not remember this stage. You may feel like you have to void, either urination or moving your bowels. Your face may be swollen and you may have blurred vision due to the positioning in the surgery. Your pain is going to be managed based on the numeric scale. The nurses will be asking you to give your pain rating 0 to 10. Your medications will be given through the IV. Your discharge from PACU or recovery room will be determined by your anesthesiologist and you. Most likely, if it takes you longer to wake up, that's the delay in the recovery room. This is a great slide to share with your family or those waiting for you the day of surgery. This timeline gives you a countdown of where you're going to be and about approximately how long you will be there. The good thing about this is the staff at the hospital are good at updating your family. You're going to be asked to leave a phone number and a name of one contact person. It's vital that you have the correct phone number so that they can contact your family. So the first hour, patient will be in pre-op. Patient surgeries, typically 2 to 4 hours. Recovery room, 1 to 2 hours. Total approximate for the day of surgery is 5 to 7 hours before you will see the patient again. After surgery, These are the things you can expect. You will have a Foley catheter in place. The urine may contain some blood or pinkish tinged urine. You may have a drain in the abdominal area. If you wake up with a drain in your abdominal area, you're the only ones that cannot shower until that drain comes out. The drain will come out at your follow-up appointment. Your mouth may be dry due to the anesthesia or the drug called atropine. Your throat may be sore from the airway used or the word intubation. You may experience eye discomfort due to the positioning during surgery. You do want to let your nurse know if this occurs. Even though it's a normal response to the positioning, we like to monitor it and document when it gets better. You will get out of bed with assistance only. Assistance only is not your wife or your family, it is a staff member. The day of surgery, we encourage you to get up and walk, but it will be a staff member that assesses your safety level. After surgery, for prevention, we're going to get you out of bed. The staff will get you out of bed. We want to decrease the chance of blood clots and post-op pneumonia. The deep breathing and coughing, you will be using an incentive spirometer. It's very important to understand that you will be using this all through your recovery at home until your follow-up appointment. This decreases the chance for any post-op issues with your breathing. 10 times per hour while awake. If you're napping or resting, it's okay to skip the incentive spirometer. But as long as you're awake during the day, and even if you wake up in the middle of the night, it's very important that you take these good deep breaths. Also, ankle pumping. Even though you're going to have your compression hose on and you're going to continue to use those, ankle pumping, pretending that you're pushing the brakes on your car, going back and forth, you want to do that 10 times per hour while awake. This helps your circulation and also decreases the chance for post-op blood clots. This is a picture of your incentive spirometer. The nurses will encourage you to use this immediately after surgery. It's a device used for breathing exercises to help prevent post-op lung complications. It is vital that you use this at home just as much as you used it in the hospital. Upon transfer to your hospital room, the nurse will review with you the instructions on how to use it. It's 10 times an hour while you're awake. An easy way to remember this when you're watching television is every commercial break, you need to be using the spirometer. Continue to use this at home until your post-op appointment. Your person will help encourage you to use this. This is a picture of your compression hose and discussion of ankle exercises. The picture shows the hose going all the way up the leg. Some of you might wake up with them just going to the knee. Whatever your doctor chooses is the right sock for you. The stockings are fitted while you were in the holding area before surgery. They should be snug but not restrictive on your legs. The purpose of these is to prevent blood clots. The slide says the length of use is 7 days. You're going to keep these on and wear them the entire post-op until your post-op follow-up. You may take them off only for your shower. We encourage you to ask for a second pair while you're in the hospital, and the nurses on the floor know this. When you're in your shower, if your loved one or your friend can wash the first pair, hand wash them and line dry them. When you get cleaned up from your shower and your legs are dry, do not put any lotion on your legs. You want to put the clean socks back on. Even with the socks on, you want to continue doing your ankle exercises. All of these measures are for prevention of blood clots. This slide is a picture of the pain medication scale. In some of the hospital rooms, they still use the 0 to 10 pain scale picture. 0 is no pain at all, 10 is the worst pain you've ever felt. The important part is to remember you've just had surgery, so don't expect to be at a 0, but nurses and staff want to keep you as comfortable as possible. You're going to be asked to rate the scale of pain, and the nurse will document where you're at. You will be medicated, and then they'll reassess to see if the pain medication is working. They work with the doctor and the anesthesiologist to help figure out a pain regimen to help with the discomfort after surgery. After surgery, it's important to understand that there's different types of pain. We're going to discuss 3 types of pain that you may experience after surgery. The incisional pain, abdominal gas pain, and bladder spasms. Depending on the type of pain you're experiencing will determine the treatment. Your incisional pain is treated at first with IV narcotics. Once you're taking in liquids and food and your stomach has been assessed, they will change you to an oral narcotic, a strong pain medicine that's going to help you with the incisional pain. Once you're weaned off the oral narcotics, you will go down to Tylenol, or you might rotate between the narcotic and the Tylenol, but you and your nurse will discuss this pain regimen. Gas pain, you're encouraged to walk and just pass the gas. The more walking you do and the more hydration you have of water will help pass the gas. Bladder spasms, the medication used for a bladder spasm is called oxybutynin, and that will be prescribed by your doctor. Vital signs and routine checks in the hospital. The nurses will be looking at your vital signs, which are blood pressure, temperature, respirations, heart rate, and oxygen level. They'll be monitoring your catheter and drainage, the wound dressing, and your IV site. The importance of all this is when you get home, you will keep an eye on your temperature, and you'll need a working thermometer at home. In case you call us with any issues, one of the questions we'll be asking is if you have a fever. Bladder spasms. You may experience the urge to urinate even though the catheter is in place. This can occur immediately after surgery and or at any point during the time you have a catheter. Not everyone experiences bladder spasms. Always check your Foley catheter for kinks when this occurs. Make sure the urine is flowing into the bag. Notify your nurse if you're experiencing discomfort. Your doctor may prescribe a medication to help with the bladder spasms. Bowel function after surgery. This slide pertains to your bowel function right after surgery while you're in the hospital. The nurse will be assessing bowel sounds with her stethoscope. Once you have bowel sounds and you are able to tolerate ice, you will be advanced to a clear liquid diet. If you can tolerate the clear liquid diet, which might consist of apple juice, cranberry juice, coffee, tea, or broth, and you're doing well with that, then you will advance to a full liquid diet. Full liquid diet is everything as above, but it also includes milk products and yogurt. If you know that you cannot tolerate milk products or yogurt, this is not the time to start taking it. If you get a tray while you're in the hospital and you know you can't tolerate what's on it, you need to talk to your nurse and change out what's on the tray. Once you tolerate the full liquids, you will go to a soft diet. These will be easy to digest foods, non-greasy, and even after you're home, avoid gassy foods. This will help you in getting your bowels back into a normal routine. Discharge instructions to go home. At home, you're going to be observing your incisions for redness or discharge. I would suggest looking at this 3 times a day, always assessing what it looks like and if it looks good. If you feel warm to touch or there's redness or streaking or any drainage from the incision line, you want to give us a call immediately. Remember, no Kegel exercises until the catheter is removed, no alcohol while taking pain medication, nor should you substitute alcohol for your pain medication. The drainage bag must be kept lower than the level of the bladder at all times. This prevents urine from flowing back into your bladder, which may cause infection. At the time of discharge from the hospital, you want to make sure that you understand each one of these. Pain medication, the name of it, how frequently to take it, and when you're leaving the hospital, ask the nurse, when can I take my pain medicine again? Because you need to know the last time that you had it. You may not go home on an antibiotic, but if you do, you want to know the name of it and how to take it. Medicine for bladder spasms. Not everyone will have a spasm, but if you do, you can call us at any time if you need the medication. Compression hose. Always ask for the extra pair and make sure you've practiced taking them on and off. Make sure you understand the incentive spirometer and that you continue to use it at home. And make sure you have a stool softener at home. OTC is over the counter, and you can purchase that at any pharmacy or drugstore. Discharge instructions for home as well. You want to get up and walk every 45 minutes to an hour. This does not mean that you have to go outside or do anything vigorous. You just want to get up and walk around your home in a safe environment, change position, and make sure that you're staying active. Avoid prolonged periods of sitting to avoid stress or strain on the area of the prostate. No heavy lifting, pushing, or pulling. No straining with bowel movements. If you're having issues with going to the bathroom, please call us at the office so we can assist. It's okay to use the stairs, but don't overdo it. If you have to go downstairs for your activities for the day, go down once and then go up once for nighttime sleep. This slide shows you the catheter, which is inserted through the penis into the bladder, where it's held in place by a small water-filled balloon. Top left picture is the Foley catheter when it's not inside the patient, but it demonstrates the balloon that is inflated. The bottom left corner is what we call stat lock. That will be on the inner part of your thigh, and it helps secure the catheter to your leg. The middle picture is the leg bag. This is the bag that you can wear during the daytime and that they will provide you in the hospital. The far right picture is the overnight bag, which you must wear at night while you're sleeping. It allows you to have drainage and better gravity so the urine can leave the body. The catheter tips we give you. On the far right is a picture of a hanger that was put into a diamond shape. This was slid between the mattress and the box springs so that the hook itself can hold the Foley bag to the side of the bed. Do not go to bed with the small bag on, or the leg bag as we call it. If you feel like you need to urinate, get up and move around, sometimes taking that pressure off and making sure that the bag is draining alleviates that pressure of feeling the need to void. If you do all the things that we've told you to do and you still feel that way, check the drainage again and give us a call at the office. The catheter daytime use bag. During the day, you may want to switch to the smaller catheter bag. This bag will attach to your leg above your knee. It can be worn underneath the loose-fitting clothes. When changing the bag, wash your hands prior to changing the bag. You want to use an alcohol wipe to clean off the port of the bag that's going into the tube. The small catheter bag should be filling every 2 to 3 hours. You can walk to the toilet and drain the bag over the commode. That way it's empty. If it's not filling up every 2 to 3 hours, you need to drink more water. Don't put the catheter through the fly of the underwear or the pants. Keep it against your leg. So when you put your underwear or pants on, you want the tubing to follow you just like your leg did and not go over the underwear. Showering with the catheter. Shower instructions by your doctor. If you have a drain, you will not be able to shower until the drain is removed. Typically, that is at your post-op appointment, but determined by the provider. Wear the large catheter bag while you're in the shower. Let the soap and water run over your incisions, but you want to make sure that the water is hitting your back and that you're not facing the water. Once you're done in the shower and you step out, you want to pat the incisions dry with a clean towel. No rubbing of the incisions, just pat them dry. For comfort after your shower, you may use some ointment, Neosporin or bacitracin. Place a small pea-sized amount on the tip of your finger and you can roll it around the catheter at the head of the penis. When you're in the shower, you can place the large bag over the side of the tub or outside of the shower stall and have the water on your back. Blood or mucus can be normal at the catheter insertion site and should not be alarming. Color of your urine. On the far right are some examples of the colors you may see. Your urine will be dark after surgery and will continue to lighten up as your body heals. And once you increase your fluid intake, it should clear. The urine colors can be equated to wine. After the surgery, you're going to see the dark red. While you're healing, you'll see the light pink. After healing, you'll see the clear yellow. Try to avoid highly caffeinated beverages during your initial recovery. Caffeine can irritate the bladder and actually be a precursor to the spasms. Also, it's very important to understand, once your catheter is removed and you start urinating on your own again, as you heal, even 6 weeks out, if you go to do an activity and you've overdone it or you've done too much too soon, your urine can go back to a dark color. You need to call the office and we will triage over the phone whether it's your hydration or the activity level, and get you back on track for your healing process. Activities to avoid after surgery: heavy lifting, driving while you have a catheter, or taking pain medicine. Definitely not while you're taking pain medicine. Catheter can be a distraction to a driver, so do not drive with the catheter in place. Straining when using the toilet for a bowel movement. Bicycling or golfing, the doctors want you to wait at least 4 weeks. Mowing the grass, whether it's push mower or riding mower, 4 to 6 weeks. Long car drives, we're trying to prevent post-op blood clots, and also you don't want that much pressure on the prostate area. So if you need to be out in the car every hour and a half to 2 hours for the first 3 weeks, you want to definitely get out and stretch and reposition. If you notice a change in the color of your urine, it could be a sign that you've tried to do too much too soon. This slide's a good date night before your surgery. Pick a friend or somebody that you care about, go out to a dinner that you enjoy, and then go shopping. These are the items that you need at home for your recovery. You want to make sure you have your soft diet items, things that you enjoy but that are easy on your stomach. The Colace, the stool softener. We don't care if you purchase the word Colace, but you definitely want to get the generic stool softener and make sure you read that it does not include a laxative. All we care about is that it has a stool softener component. Men's leak guards, you can find those at most pharmacies and drugstores. These are important, and you want to bring one of them with you to your post-op appointment because that catheter is going to come out and then you're going to want to put that leak guard on. You want to bring extra strength Tylenol into the house. This can be rotated with your pain medication. Be mindful when you're taking your medications. It's good to have a little card by your medications with the pen. You can write down what you took and what time you took it to keep track of what you're taking and that the interval is appropriate. You want to purchase the Neosporin ointment just for comfort to have at the house. And then your Gatorades or your clear liquids that you want to have on hand to rotate with your water intake and also for your pre-op drinking. Sexual function and urinary leakage. If sexual function is important to you, we recommend that you schedule an appointment with Chuck Wadsworth, our physician assistant. Chuck runs our penile rehabilitation program where he will work with you to ensure that you have the best opportunity to regain sexual function and continence, which means no urine leaks after surgery. Some people prefer to talk to Chuck prior to surgery, and some prefer to do the entire healing process and then see him. There's no right or wrong to this, and he's available to you when you need an appointment. Just give our office a call and we can schedule. Throughout your recovery, if you have any questions, please do not hesitate to contact your physician's office at the number provided, 804-330-9105, or you can text or use your portal. Many find in support groups the help that they need where they can share their experiences and learn coping skills. Support groups can help to reduce the stress and minimize depression. Having a positive outlook may allow the body more effectively fight the disease. If you have any questions after this, you can give us a call or use your portal to send our questions back and forth. The important part to remember is once you wake up from surgery, it's all about healing and prevention. We want to prevent blood clots, post-op pneumonia, and infection. So follow the instructions, come to your post-op appointment, and call with any questions that you may have.